Pregnancy is a really exciting time, and when you find out you're pregnant, it's very exciting as you know that you're going to have a baby soon. During the course of pregnancy, however, we have to remember that the baby can act as a compression or pushes on the veins that lead out of the legs and goes towards the heart. What this can do is it can lead to an increased incidence of swelling in the legs, varicose veins, varicosities inside the pelvis itself that can be very painful. Sometimes these varicosities can bleed, sometimes they can clot off, and patients can present to the hospital with DVT, which is deep venous thrombosis, or even superficial phlebitis that can both be not only painful but also deadly to not only the baby but the mother as well. If you develop leg pain, if you develop a swollen leg worse on one side than the other, if you notice that there is a vein that was varicose before and now is hard and red and painful, you need to seek medical attention right away. What we can do to help that is to place stockings and make sure that we wear them throughout the course of the pregnancy. They make maternity stockings, and even though they're uncomfortable, they're extremely important to wear. What that'll do is it'll keep the veins from pooling with blood and allow it to circulate properly. After the pregnancy then is a good time to seek further attention. A lot of times these veins get a lot smaller once the baby is delivered, and sometimes the patients will not have any problem at all and don't have any further issue with it. Sometimes patients come back with continued varicosities that can either be unsightly or painful, and then we can deal with those by getting the appropriate ultrasound workup and removing the veins either surgically or through non-invasive manners. If you've been diagnosed with deep venous thrombosis, this could mean that it could be caused by many things. Trauma is the most common thing to cause it. Other issues are stasis, meaning the blood is not flowing properly, but it pools. Thirdly would be what we call a hypercoagulable state, and that means that there could be an underlying blood clotting disorder. People who have that generally will have a family history of maybe a relative, a blood relative that has died of either what we call a pulmonary embolism, which is a blood clot that goes to the lung, or the patient themselves will tell us that they've had a history of previous blood clotting. DVT or deep venous thrombosis is treated with blood thinners, and then depending on what we think, it is either stopped after a few months or it sometimes has to be continued for life. Those patients who also have a blood clot that breaks off and goes to the lungs sometimes are treated with what's called a greenfield filter, or a filter that's placed in one of the big veins in the body to help filter any further clots from going to the lung. If you've been diagnosed with a DVT and you are on birth control pills, your likelihood of developing further clots while on hormonal therapy is increased with advancing age. Those women over the age of 35, especially if they smoke, really need to speak to their OBGYN doctors about other forms of birth control, as they are at greatly increased risk for blood clotting.